medical appointments. Now, I'm sure we all know that medical appointments can be deeply emotionally traumatizing. I mean, it's the same cycle every time. You manage to get an appointment, which can even be a challenge these days, and then you have the build-up, where you're worried about, firstly, how the health professional is going to be with you, because sometimes they can be nice, sometimes they can be stern, sometimes they can be very knowledgeable, and other times it's just not in their wheelhouse. So there's that. And then you've got the stress of actually going to the appointment, what you're going to say, how you come across and connect with the professional is important as well. So there's many things to consider. There is, however, some things that you can do to help the situation. So my advice would be to, firstly, a lot of prep before the actual appointment is important. So what I mean by this is really have a think about the specific symptoms that you want to discuss, and also any seemingly unrelated symptoms, because sometimes they are connected, we're just not sure how they fit together. So firstly, write down everything that you think you might want to say or bring to their attention. Write it and maybe rewrite it a couple of times so that you want to get across the facts, and maybe have a separate bit as to how it affects you physically and emotionally, because it is important to tell them that, but when it comes down to it, they will be interested in the facts. So once you've written all this down, try and get it in an order that is easy for them to understand. So it flows nicely from one thing to another to another. That will help the appointment go a lot more smoothly. Another thing you can do is discuss the appointment beforehand with someone who spends time with you regularly. So say a friend or a relative, or maybe a healthcare support worker that you regularly see, because sometimes you think that something isn't worth mentioning, because to you it doesn't seem like a big issue, but someone else who sees you struggling with a specific thing or doing something in a certain way might say, actually, I really think you should mention that. It clearly has an effect, or it clearly interferes with something specific that you need to do, whether it be like a way you move or something that really affects you mentally, or knocks on with your, say, anxiety, or puts you off doing something, because things like that are really important, even if it feels to you as if maybe that's just me being silly, but it's all important, it's all relative. So once you've discussed it with them, and maybe go through the order that you want to talk about things with the professional, with your friend, relative, support worker, because sometimes it's always good to have another point of view. So if you feel like this, and this, but then someone will be like, looking at you though, I see this, then I see this, then I notice that. So again, good different points of view are always helpful. Then you've got the actual appointment, thinking of if you need or want a chaperone. You have a right to have a chaperone, and if that's something you feel would be helpful or that you need, then I would definitely have one. So again, friend, relative, possibly a support worker if they have time, can come to the appointment with you. Now, this can be helpful particularly if you're like me, and sometimes being in an appointment and discussing these issues sometimes is a bit overwhelming. So having someone who is not quite as emotionally connected is helpful, because when you struggle to say things, or perhaps struggle to put it in the right way, they can then assist you by taking over or reminding you of something that you perhaps forgot in the moment. They can go over things with you beforehand, so they have an idea in their head about how you want the appointment to go. And so, yeah, in the appointment itself, they can really help things flow. So, I mean, everyone finds appointments upsetting purely because it flashes a blinding light on your problems. And sometimes, if you're like me, the only way to get on with life is to keep going and ignore things like injuries or issues. And shining that light on it really is emotionally wrenching, because it's difficult sometimes to acknowledge things that are happening to you. So the appointment itself, it can be overwhelming, or it can be emotionally draining to speak to someone in such a frank and open way. So once you're in the appointment, you've got across your points to the professional. Then comes their opinion, and doctors have much varying ranges of skill, knowledge, and unfortunately their opinions vary greatly depending on who you see. So if you have someone who is straight away trying to shut you down, that can be very upsetting. But you have to keep in mind that just because they don't know about something does not mean it doesn't exist. You know what is happening to you, and you know what you've experienced. And someone doubting that can be extremely upsetting. But yeah, just because they don't know about that specific issue does not mean that it doesn't exist. Okay, they are sometimes quite ignorant as to your problem, and it can be quite disheartening to experience that. And if they say, well, I don't think that's a thing, or I don't think that is connected, or that should be a problem. Again, they don't live your life. They don't know really how it feels. And if they say no, or I doubt it, or something similar, you can ask them to explain what it is that makes them think that, and what evidence they have to suggest that that is not the issue. Which brings me to my next point. Before going to your appointment, something I have found very helpful is researching symptoms. Now, you have to be careful with this, because type something into Google and 101 things will come up. So try and narrow down really what you think the issue is. I know this is not our job, this is the doctor's job, but sometimes it is just better to do your own research beforehand. And if you find something specifically helpful to the appointment, or that you feel supports your stance on it, then either save the web page on your phone, or maybe have it in an email so you can email it to the doctor's surgery, or even print the information out and then you have it physically in front of you when you're seeing them. This can be good for referencing. You can point bits out that you feel are necessary, and also if it's published by a consultant or a doctor or a professor, it is a lot harder to argue with that rather than just trying to say it's your opinion. A doctor may think that something you've got carried away or something about your situation is just caused you to panic. And yeah, sometimes that can happen. But when you have another medical professional, sometimes a group of professionals, publishing papers and research on the thing that you're talking about, that is a lot harder for the doctor to ignore. So point out bits or maybe highlight bits that you think are relative, and also there are certain charities which you can look up. So if, for example, my condition, there are two major charities that I often reference, and they have a lot of information on their webpage. They also have helplines that you can call to get information, or sometimes if you're in a crisis and you need support, they can be very helpful for that. So again, once you've got this evidence from the charities, the websites and the doctors that they work with, that is again a lot harder for the doctor or consultant, whoever, to deny. So once you've got that, there are also many times there is authors of specific books and research to do with your issues. So I was lucky enough to see my local chronic pain clinic, or service as it is now, and the physiotherapy expert from that clinic made me aware of a book that had been published a few years ago, and essentially it was not just one doctor, it was many consultants and doctors that had all worked together on my condition, and she had put all the research into one place, which means that every time I'm worried or I'm getting a hint of something, I can reference this book, and I can look up the bit that I feel, and then I can read, and it's like they've written a book on me, you know. And it's comforting to know that even though it's a new symptom for me, it's not necessarily unexplainable, because it is under the umbrella of my condition. And I have taken this book with me to appointments previously as well, because again, then the doctor is not just arguing against one paper, it's arguing against the whole book of evidence. So anything you can get that is professionally published or researched is helpful. So then we've got the difference between GP appointments and consultants. GPs, some of them are very good, and some of them do have opinions, and others have maybe a bit of a gap in knowledge. It is, in my opinion, very potluck as to who you get to see. So more often than not with my condition, you have a referral to physiotherapy, which can be a double-edged sword. But with GPs, I have found the best ones that I've seen will admit they don't know much of my condition, and they will essentially say, you give me the research to support what you're saying and I will provide you with what you ask for, which in my opinion should be the way of it all the time. Other GPs are very set in their ways. They will have certain pre-formed opinions about you and your condition, and it is a lot tougher to really get them to listen. And these certain GPs, even if they do seem to be listening to you, I do feel like there's a certain amount of gaslighting going on. So trying to make you doubt yourself. If you say you have a certain symptom and they may be trying to cast doubt on that, like, is it really that bad? Or I'm sure if we just do this, then you'll be fine. Which again is not helpful, but we all come across it now and then, and the best thing to do in that situation is accept that the appointment's not going to go anywhere, and wait for another appointment to see a different GP, and you may do a lot better in that than your initial consultation. So yeah, GPs are very much jack of all trades, master of none. And sometimes that can be emotionally painful to sit through an appointment like that. But the best thing to do is just cut your losses, accept that's not going to be a good appointment, accept that they clearly have no idea what they're talking about, and wait and make another appointment with a different GP. I suggest writing down the names of the GPs so that you don't accidentally see the same one again, and go from there, really. The next thing, consultants. Seeing a consultant is sometimes better, sometimes worse. Again, they will have their own opinions on your condition and what you present like. Invisible illness, as I've said before, they seem to judge you on how you look, which is completely inappropriate for an invisible illness. Consultants will have more knowledge in their field, but some conditions are rare, which means they are not covered by a lot of the modules that the consultants have to do. Sometimes it will be the case that they would have had to have gone out of their way to learn about the subject, or potluck, they've already dealt with someone that has the same condition. But even then, that creates complications because your condition may affect some people differently than others, and you can't judge one person the same as another, even if it is the same condition. You know, everything affects everybody differently, and it's just not appropriate. So then you have things like physiotherapy, hydrotherapy, general kind of issues to do with mobility, and occupational therapy appointments, like trying to help you find ways to get around the house easier, or when you go outside, if you need help with anything there. When we see a physiotherapist or a hydrotherapist or any other therapist, most of the time they will be more knowledgeable if it's something to do with mobility, or if you see like a psychotherapist, they may have a lot more knowledge on mental health issues. That being said, there is always one. I have seen many physiotherapists over my time, and again, they vary greatly. I have had therapists give me seemingly easy exercises, but because it's targeted on one of my weak areas, it's just not possible for me to do it. And even if I try, I can sometimes do a simplified version of it. But again, it depends on the professional and how they treat you as an individual. Recognizing that sometimes going straight into an exercise is not an option is important, because sometimes we have a really weak spot that is easily injured or doing physiotherapy and hydrotherapy and any other type of therapy is always daunting. And again, it's mainly because you don't know what you're going to get. You could have a very knowledgeable therapist or a very sort of highly knowledgeable in some fields but big gaping gaps in other fields of knowledge. I've had therapists give me exercises which have proved useful and helpful. I have had some that clearly have no knowledge of my condition whatsoever, and want to treat me like a regular person. One of them even tried to get me to do squats. You can imagine how that went. It's difficult, I know, but sometimes you need to be able to stand your ground. If someone says, do this exercise, and you know that it's completely inappropriate for you, you need to try your best to speak up and get them to acknowledge they need to change their approach. Yes, some exercises are helpful, but you really need to go through it carefully with the therapist to cherry pick which ones are right for you. Some exercise therapy can be indeed a lot more harming to you than the benefits would be. Yes, I've had quite a few injuries. I mean, I'm one that will try anything, so I won't say no to things initially, but if you're giving something a go and you can feel that it's not right, it's causing too much pain, or you're getting movement somewhere that there shouldn't be, then you need to stop and tell them that you need to stop. They need to recognize that when you're starting, you need to start from zero. You cannot jump into where an ordinary person would start. You need to build up to that point. I've had some therapists that have examined whichever injury that I happened to be seeing them for at the time, and told me that exercise is not an option for me in that area. Either the joint is too unstable or the area around it is inflamed, in which case they can offer you other treatments like infrared therapy, ultrasound therapy, wax hands is another one that I've done, which is actually quite nice. So don't go to an appointment thinking that it's going to be this big hoo-ha and it's going to be painful and you just don't want to do it, because it's always good to give it a go, but You need to be clear on what you can and cannot do. Which leads us to after an appointment. I mean, some appointments I've had, I've barely been able to make it out of the room before bursting into tears. Whereas it's other appointments I've had, I've walked out and I've been so pleasantly surprised by the level of support I received in the appointment. So it is literally one end to the other and all things in between. If you come out of an appointment crushed and upset, it's important that you take a couple of days to reset. It's devastating when you're not listened to, and it can cause emotional trauma, and it can almost make you feel as if you want to give up. Now take the couple of days and try and get back to that calm state and reevaluate the situation. Your illness is the same, it's not changed. You know, and you can reaffirm your issues that you're having and what you need help with. And you can remind yourself that not every medical professional is the same. You have a right to pursue a certain quality of life. There is absolutely no reason why we should all be left to suffer in pain and suffer with the things that prevent us from living a normal life. No one expects to be 100% pain-free. No one expects to be mentally cured, full of confidence, up and about, ecstatic type thing. That's more than often not the reality. And it's still worth pursuing a certain quality of life. Even just getting the pain down a little bit, or being able to raise your head to look at people in the face instead of looking at the floor. It's all issues that affect you, and it's all things that you deserve support for. Even if there is no cure, you deserve the support that you need. I have had bad experiences with bad health episodes, and I have been unable to move for days at a time. And it's very easy to think that you wouldn't even leave an animal to suffer like that. I mean, I don't want to be put down, but it is true that sometimes people with invisible illness or chronic illness or mental illness are left to cope. And this is where it's really important that you have support in place, either friends or family, or support workers. But it all kind of revolves and stems from the GP. It's always your first point of call. So once you can see a doctor who is willing to listen and start the ball rolling, then you see hopefully a consultant or two or three in their specific areas. And it's all about bringing all of that and the support and the family and friends support, medication, therapies. It all plays a part. And once you get all these things in place, I know you can feel like giving up sometimes, and all I can do is urge you to keep going and keep pursuing it, because once you get all of these things in place, you will have a life that comes together. It may not be the life you were expecting to have, but you can make good on it. You can move things around, adjust things. You got your lifestyle, work, obligations. Everything can come together with the support of all these other professions and professional people. And once you have it together, I promise you will feel better for it, and you will start to enjoy life again. That is my absolute promise.